Conceptualizing age-appropriate care for teenagers and young adults with cancer, a qualitative mixed methods study. Teenage and young adult cancer care in England is centralised around 13 principal treatment centres alongside linked designated hospitals. The term age-appropriate care is the explicit term used when communicating the nature of specialist care for teenagers and young adults. Despite its frequent use, what we mean by age-appropriate care has never been fully defined. The aim of this study was to develop an evidence-based, contextually relevant and operational model defining age-appropriate care for teenagers and young adults with cancer. As part of a wider case study, interviews with healthcare professionals and young people were conducted. Interview data were extracted specifically about the term age-appropriate care. An integrative review of the literature around age-appropriate care was conducted. This was synthesized with the extracted interview data, generating the data which created the model defining age-appropriate care. 7 components of age-appropriate care were identified and are as follows. Access to best treatment. Healthcare professionals having both clinical and holistic expertise in caring for young people. A recognition of the individuality of young people. To have good communication, interactions and relationships, both between professionals and also between young people and their healthcare teams. To empower young people and involve them in service developments. And to promote normality where possible for them during their cancer treatment. And finally, to provide a physical environment which facilitates a social environment for young people to connect with their peers. This presents the model in its entirety. When all present, the 7 components of care interact and connect to provide optimal age-appropriate care for teenagers and young adults. In conclusion, age-appropriate care is complex. The model displays the depth behind the words and the many components that are involved. Therefore, we encourage mindful application of the term age-appropriate care. Critically, it is also relevant to other healthcare services which young people access.